45,000 people per year die for lack of healthcare insurance because they can't access the system.
There's so many people in this country who don't have insurance. The estimates are now close to 50 million people. But a lot of times people make assumptions about who these people are. Many of them are actually the working poor and the working middle class. It's just becoming more and more difficult for employers to actually offer health insurance. And a lot of my patients who are paid by the hour and work 5 days a week, 6 days a week, even some of them 7 days a week, they don't get health insurance with their work, and that's a lot of the people who don't have health insurance.
I still was one of the many thousands of Americans who go bankrupt even with insurance. I was one of the classic cases of underinsurance, and that I was the only policy available to me at the time through an employer was a high deductible, high copay plan that when I actually had to use that insurance left me with huge bills. Now the Affordable Care Act does limit some of what people are exposed to, but for me, having a maximum out-of-pocket exposure on a plan of just $10,000 a year was enough over a couple of years to throw my family into loss of home, bankruptcy, and lots of really horrific financial situations.
I think although copays and deductibles might be really high for a lot of patients, I think one good thing about the ACA was that there are no more lifetime limits on how much insurance plans pay out, and there are no annual limits either. So I think a lot of patients that are extremely sick are definitely going to exceed their, what would have been their lifetime limit, and now I think are at least have that security blanket.
Insurance is not health care. Insurance is a financial product sold to protect our health and wealth, which may do neither thing very well. And I think that, as we see the Affordable Care Act be implemented or repealed, depending on which way our election goes in November, we may see more situations where people have insurance but still cannot afford to actually access the care that they need.
Healthcare costs have been rising faster than the GDP for every decade for the last 30 or so years. We spend now much more than any other country per person in healthcare, and that's even considering the fact that not every American has insurance or has access to healthcare. The question here is not whether we're going to deal with costs, but it's how we're going to deal with costs. It's whether it's acceptable for us to shift more of that burden onto American families.
Well, even with the unemployment rate, you have to I fear if I ever lost my job, I'd lose my health insurance. And I can't have any other way of getting health insurance besides getting another full-time job to insure my family.
Our healthcare system has plenty of money in it. It's not a question of not having enough money. It's how we spend the money and who profits from it. And one of the reasons for doing treatment sometimes, it's not a good reason, is for profit, for the profit motive. And our whole system is based on the profit motive.
Insurance companies that really are private entities that are on Wall Street. They make money by making money. That's what their business is. Their business is not making people healthy. That's not it's making their stockholders secure. It's not making patients secure.